Well, I think there's a lot of lameness issues, above the foot. And when those horses start going off or go sore, they're often going to alter the way they land their foot to protect a certain area. So all of a sudden that foot starts becoming a problem or deformed, and the farrier's not really sure what's going on here, when the problem is, it could be a foot to 2 feet above where he's working. So this gives them the opportunity to know, oh, I understand when that horse has a stifle problem, or oh, that hock or that ligament is going downhill. How's that going to affect how this horse lands? And then am I going to need, like, for example, Dr. Thayer's great talk today on suspensory problems. What kind of shoes should I be putting on, and which is exactly what not to put on? And so it's a whole new regime and a whole new group of talents that they can hone in on by having the knowledge of these things that are up above, versus, okay, there's the classic thing where a lot of veterinarians in the past were always thought where the horse ends at the withers, and sometimes with farriers they might think like the horse ends at the pastern. And if they have that knowledge up above, especially, for example, if they're shoeing a horse and he's really having a lot of problems holding that leg, and it might be that he's got a bad stifle or a bad hock, and then he can tell the veterinarian and cue us in on that. So the more they know, the better everyone's going to be. And they sometimes are really they're seeing that horse, at a minimum, if they're shoeing every 4 weeks, they're seeing it 12, 13 times a year. We're seeing it 2. So they're 6 times more familiar with the horse than we are. And so they can sometimes say, hey, maybe you need to come in and look at this horse for lameness, or maybe you need to come in and pull a blood test on him. And we're not going to know that because the owner's not going to say anything. So they help us. And then if we can get that problem, then that horse lands better, and then we help them.